800,000 low-income Oklahomans depend on the Oklahoma Health Care Authority to pay for some or all of their health care needs. Starting January 1st, many of those services will be reduced or eliminated.
We covered 420,000 kids in the state of Oklahoma, and we want to have as little effect on that as we possibly can.
So the majority of services cut or eliminated will be for adults. One thing that will affect children is a change in dental services. HCA will no longer pay for cosmetically pleasing white resin fillings, switching instead to cheaper amalgam or silver fillings. With little discussion, the HCA board this afternoon unanimously approved a laundry list of recommendations to slash millions from its budget. The state's budget crisis means HCA lost nearly $17 million in state funds. Nearly all those funds have matching federal dollars, so the actual loss is closer to $70 million in medical and dental services that can be provided.
We're looking at some budget cuts that we have never even thought about before.
Many cuts involve durable medical goods like diabetes testing supplies. Adults will be restricted to 100 glucose test strips per month, and HCA will no longer pay for glucose monitors, portable oxygen, or adult nebulizers. Price caps will be put on nebulizers for children. The HCA is also curbing access to name-brand drugs.
We're going to reduce the number of brand name scripts that we pay for. We're going to pay for 4 generic scripts and 2 brand name scripts. Now we're paying for 3 and 3.
Some mental health services and provider reimbursement schedules will also decrease.
Rather than buying a bottle of oxygen for the home or some pharmaceuticals that can keep the patient at home at much less expense, the state may end up paying more by having to pay for an inpatient stay.
Dr. Stan Grogg says free clinics will also feel the impact.
Those kind of facilities are going to be really burdened to take care of the increased numbers of patients coming to them.
At this time, HCA isn't changing its reimbursement rates for delivering babies, nor is it adopting a recommendation for a 1% decrease in provider rates. But board members say today's cuts are not likely to be the last if the state's budget crisis continues. In Tulsa, I'm Cathy Tatom, the Oklahoma News Report.